मैं डॉक्टर आर के प्रसाद आर के ऑर्थो आश्रम मदारपुर से मैं बोल रहा हूँ। आज मैं कार्पल्स बोन को बताने जा रहा हूँ। इसको बहुत इजी ढंग से बताने जा रहा हूँ जिससे कि आपको कोई दिक्कत नहीं हो, याद करने में कोई दिक्कत नहीं हो। पहले तो आप जाने कि कार्पल बोन्स 8 इन नंबर्स होता है। इसका नंबर जो है सो 8 होता है, 8 होता है। 4 in the proximal row and 4 in the distal row. Proximal is towards the wrist, distal is towards the hand, towards the metacarpal bones. This proximal row articulates with radius and ulna. This articulates with radius and ulna. Radius and ulna. Articulates with radius and ulna. Proximal row. This proximal row here, just I will show you. Suppose this is ulna with a stelloid process, and this is radius bone. This carpal proximal row will articulates with radius and ulna. It will form a convexity. The whole bone will form a convexity towards radius and ulna, and there is concavity towards in the distal part. There will concavity over the distal part. Distal parts articulate with the distal carpal bones, and distal carpal bones is convex, arranged in a convex fashion, and then it is flat, which articulates with the metacarpal bones, all the metacarpal bones. Therefore, these two rows of carpal bones proximally articulates with radius and ulna, distally it articulates with the metacarpal bone. Important point is to remember the seriatim of the bone, how it is arranged. If you will be asked in your exam that tell me the pattern of its arrangement, it will start from lateral. Then you have to say lateral to medial, lateral to medial. This is the lateral and this is the medial. In wrist, the thumb side will be lateral. This is the anatomical position. The thumb side will be lateral, and the ulnar side will be little finger side will be medial, or ulnar side will be medial. The name is scaphoid, lunate, triquetrum, pygiform, and then trapezium, trapezoid, capitate, hamate. How you will remember it? Just you remember this line. She looks too pretty. Try to catch her. She looks too pretty. Try to catch her. You remember this line? She looks too pretty. She means scaphoid. Looks means lunate. Then the third, two means tracheotomy, and pretty, P means pygiform. S L T P. She look too pretty. She looks too pretty. Then the distal row, it will be try to catch her. Try to catch her. T, trapezium, 2, trapezoid, catch, C is capitate, and H is hamate. Hamate. Therefore, you will remember she looks too pretty. Try to catch her. This is one important point which you will be asked, and if you remember this, then there will be no problem in arranging the name, and always you will tell from lateral to medial side. This PG4 is a sesamoid bone. It is called a sesamoid bone. Sesamoid bone. Sesamoid bone. The sesamoid bone is that bone which develops in tendons. Here laterally there is tendon of flexor carpi ulnaris. Flexor carpi ulnaris. You will know it later on FCU. Here, this PG form bones develops in tendons. This PG form is in tendon. Another example of this type of bone is patella. That is called sesamoid bone. Sesamoid bone. The bone that develops in tendon is sesamoid bone. One important is PG form, which gives attachment to the flexor carpi ulnaris, and second very important bone is your patella, your kneecap, that is attached with the quadriceps. Then you have the one thing you have arranged from lateral to medial, proximal row and the distal row. Then you are asked about its ossification. Any bone that develops is first in cartilaginous form, except few just like clavicle that develops in membranous form, not in cartilaginous form. Clavicle develops in membranous form, not in cartilaginous form. Therefore, this ossification centers develops in all the bones, but there are period in which it will develop, and that is very important for medico-legal importance. One is that capitate is first ossification center. This capitate is the first ossification center, and PG form is the last ossification. Just remember, capitate is first ossification center, and capitate is the largest carpal bone. It is largest carpal bone, and it is the first ossification center develops in capitate. Then it is easy to remember that hamate and capitate starts developing in intrauterine life. Intrauterine life means that when the baby is in the womb, the ossification center develops in capitate and hamate bone, and the easy way to remember is that during first birthday of the baby, you will see this capitate and hamate bone. All other bone will not be visible in first birthday because there is no ossification center. It is made of cartilage. Cartilage is radiolucent. It doesn't appear in X-ray. Therefore, first birthday X-ray will show only capitate and hamate. This capitate hamate starts developing. The ossification starts developing during intrauterine life of the baby. Then the last to ossify ossification center is PG form. This PG form, which is a sesamoid bone, which develops in from flexor carpi tendon, and it is nearly 10 to 12 years. Therefore, when a baby comes at the age of 10 to 12 years, and if you have to verify its age, what is the age of the baby, then you take an X-ray. If PG form is apparent uh, in X-ray, then the child is of 10 to 12 years. If only this two is this capitated hamate is present in X-ray, then the child is below 1 year, below 1 year of age. Or then comes the escapade lunate triquetrum. Triquetrum at 3 years, just draw a line. 3 years, lunate is 4 years, 3 years, 4 years, and escapade trapezium trapezoid 5 years. It is now not difficult to remember for you, because at birth intrauterine ossification starts in capitate and hamate. You can find ossification center in newborn baby, or it can be cartilaginous later on it can develop. Therefore, just remember that during first birthday, you will find that this two bone, if you find only these two bone, capitate and hamate, you will say that the child is below 1 year of age. Then, if you find this PG form ossification center, then the child is should be at the 10 to 12 years of age. Then at third year, if you find this ossification center third birthday, then it will be the ossification center will appear in trapezium. Triquetrum, trapezium trapezoid is here. Triquetrum, trapezium trapezoid. And fourth birthday you will find lunate, and fifth birthday you will find all the three. Therefore, by this you can determine the age of the child. Age of the child can be determined by seeing the ossification center. All these ossification center fuses at the age of, it is complete at the age of 20 to 25 years of age. Then, after knowing all this, one important thing you have to know, that is called applied anatomy. What is the applied anatomy? What we see clinically, and which is of more importance. The most important bone to be fractured is scaphoid, which is boat shaped. Scaphoid is boat shaped, and usually from west of the boat the fractures develops. The important thing to know is that scaphoid gets its circulation from proximal to from distal to proximal. This is the distal part. Distal to proximal, the blood vessels come here to supply the proximal part. Just I am drawing a better picture. Scaphoid is boat shaped. This is the distal part. Distal part. This one is proximal part. Proximal part articulating with the radius. It is laterally situated. Radius is situated laterally, articulating with the radius. Usually there is fracture at the base. west of the scaphoid bone. It is boat shaped west of the scaphoid bone. The blood supply to this bone comes from distal to proximal. Distal to proximal. There is no other blood supply to scaphoid. Suppose there is fracture from the west. What will happen? The circulation of this part will be interrupted. The proximal part which articulates with the radius, the circulation of this part will be disturbed. And when the circulation will be disturbed, it may undergo avascular necrosis. That is called AVN. Avascular necrosis. Avascular necrosis means this bone may die. This bone may die. Therefore, this is a very dangerous fracture. A scaphoid fracture is very dangerous, and when you get a case of a scaphoid fracture, always explain to your patient that the proximal portion, this portion will not die, distal portion, because it is having the blood supply. The blood supply interrupted from this part. Therefore, proximal portion may undergo avascular changes, may lose its blood supply, and that is called AVN, avascular necrosis. Always explain to your patient that this person may die. If this person will die, what will happen? There will be arthritic changes, roughening of the joint surface. When it will collapse, when it will die, there will be roughening of the articular surface. Roughening of the articular surface, this will lead to pain in the wrist joint. The wrist joint will become painful, and you may have to fuse. Sometimes it is so painful, it is so troublesome that your patient is always in pain, and in that situation, you have to fuse the wrist joint so that there should not be any movement at the place, and it is fused in functional position, and there is no any other option except fusion of the joint if it becomes rough and painful due to avascular necrosis. Another important joint, and this is called, sometimes you may ask in your exam. This is of very clinical importance. Therefore, the first bone to fracture, the bone which can be fractured and which is the most important carpal bone, and most common fractures develops over the scaphoid bone. It is due to fall on outstretched hand. When your hand is outstretched like this, it can lead to college fracture, that is fracture of the lower end of the radius. It can lead to fracture of the scaphoid, and scaphoid fracture can be a dangerous fracture, and it can lead to avian changes, and it can lead to destruction of your wrist joint, and you may require fusion of the joint to relieve pain. Another important bone that is usually fractured is lunate. This is called applied anatomy. Applied anatomy. Therefore, you should have knowledge of applied anatomy, and you may be asked in your exam. And if you will reply this, your examiner will be pleased to see your answer, pleased to hear your answer, and you will get a better marks. Lunate, I told that laterally there is a scaphoid, with a scaphoid there is lunate, a scaphoid lunate, trichotrum, and then pisiform, which overlaps over the trichotrum bone. This lunate bone dislocates. It doesn't get fractured. It is semi-lunar in shape and dislocates from the wrist joint. It dislocates, comes anteriorly over the wrist. You have to reduce it. Otherwise, if it remains unreduced, again your wrist will be disturbed and it will be a painful wrist. Therefore, these two bones, the scaphoid and lunate, is prone for injuries. Scaphoid is prone for avascular necrosis. Scaphoid is prone for osteoarthritis over the wrist joint, and it may need fusion of the wrist joint. This is all about carpal bones. I think you need not know more than this at this stage. Thank you. इसको बंद करना होगा.